People can burn themselves in different things. It can be a dry heat if you touch an oven grill. You can have flames that catch through that can cause serious burning. Hot water or steam, chemical, electrical, sunburns, these all things cause damage and inflammation of the skin. But do you know how to react if that happens to you or someone else? Because simple first aid actions can reduce pain, swelling, redness and infection. Do you want to know more about it? Keep up watching. Hello everybody, welcome back to my channel where we talk about first aid, health, skincare and cosmetic products. If you are new to my channel, don't forget to subscribe. Let's start first by a quick explanation of skin anatomy. The skin is divided into three layers: epidermis, dermis and hypodermis. The epidermis, well, that's really the outer, the superficial layer of skin, followed by the dermis, which contains hair follicles. This is where the hair starts growing. Sweat gland, their main function is to control body temperature. And of course, nerve endings, the ones that really send messages to your brain when feeling sensations such as heat, cold or pain, followed by the hypodermis just beneath. And of course this is really the deeper layer of fat, connective tissue, and of course just before tendons, bones and muscles. Let's talk about the types of burns now, and there are three. Starting by the first degree, this is actually the burns that affect the superficial or the outer layer of skin. A mild sunburns can be a cause. Like example, the skin will appear red, tenderness and also painful, but you won't have blisters, and usually heals in less than a week, and you probably won't have scarring. Second degree, if you have this type of burn, the outer layer as well as the one underneath, the dermis, the both has been damaged. The skin may look bright red, swollen, shiny or even wet, and you will see blisters. Intact or broken, it depends. The burn will hurt to the touch, for sure. Usually heals approximately between 2 to 3 weeks, and there is a possibility of leaving a scar or maybe changing the color of the skin, a permanent change of color of the skin known as skin pigmentation. Third degree, this type of burns destroys full layers of your skin. Instead of turning red, the skin may appear black, white, brown or yellow. It will not hurt actually, because the nerve endings has been damaged. And if it goes deeper, it can destroy the bones, the tendons and muscles. And it will not heal without a surgery. Your actions now towards first and second degree burns. First step, you need to remove jewelry and clothing from the affected area, and this is for two reasons. Well, to treat the burn properly and to allow swelling. As I told you before, it can happen. And imagine with me a swollen finger with a ring inside. This of course will interfere with the good blood circulation. But before you do so, make sure that nothing is sticking into the wound. If it does, just leave it there and try to cut the surrounding clothes only. As a demonstration, in this case I will remove my watch gently. Second step, cool the burn with a cold running water for at least 10 minutes. Very important, cooling the burn will reduce pain, swelling and the risk of scarring. The faster and the longer a burn is cooled in the cold running water, the less the impact of injury. And never use ice because it may further damage the injured skin. It only slows down the healing process. Third step, you apply relief gel or burn cream, but avoid touching the wound with bare hands or in sterile objects. In this case, I will use gloves. And do it gently because we don't want to break any blisters. So you take a good quantity of the ointments and you apply it above the burn part. And you can repeat it 3 times per day. And if you think about applying a toothpaste, oil, honey or butter, just forget about it. It's not useful at all. It will only increases the chance of infection. And something else to remember, more you elevate the burned part from the level of your heart, more it reduces the pain. And a painkiller is recommended like paracetamol. To avoid scarring and pigmentation of the skin, you can use after a week a healing cream that provides a high sun protection and accelerates the healing process by reducing the appearance of scarring. Now, how about the third-degree burns? Unfortunately, we can't treat it with the same way because the risk of infection, blood loss and shock is very high. So don't attempt a self-treatment. In this situation, you need to seek medical attention as soon as possible. And that was today's video. If you are new to my channel, don't forget to subscribe, leave me a comment and hit the notification bell to receive my latest videos. Thank you for watching and see you next time.